Our next speaker is a direct support personnel who works at the Arc of Blackstone Valley, Nancy Timmis. So let's hear from the first person who does the work.
Hello. My name is Nancy Timmis, and I've been a direct support professional for 27 years at the Arc of Blackstone Valley in Pawtucket. I'm here today to help with supporting the Demanding Dignity campaign, whose goal it is to help inform the Rhode Island legislature as to why DSPs need a living wage, explain the staffing crisis that we are currently in, and simply to educate them as to what our job entails. Taking care of adults living with developmental disabilities is rewarding but incredibly demanding work. My co-workers and I act as teachers, healthcare professionals for our clients. We are their mentors, their advocates, and their surrogate families. Every day we have to make decisions in our occupation. Some of them are small, but sometimes they're a matter of life and death. As an example, we had one client with chronic pneumonia. We had to determine every day whether to report his condition to our director, a staff nurse, or to call 911 to send him to the hospital. On another occasion, while working a night shift, I heard a client having a seizure in her sleep, rushed into her room. As she came out of the seizure, she stopped breathing. We had to do CPR on her while we waited for help to arrive. Another client who has a high risk of choking requires that someone sit with him every single time he eats anything. He's needed the Heimlich maneuver done many times in the past. We are responsible for administering all types of medication and all treatments, which in any other setting in a job is a job that a nurse does. Last year, a new job task was required of the DSP workers that I work with and myself. There were no beds available anywhere due to the flu epidemic last winter. We were asked to become hospice care providers. All of us on my team immediately said yes. We went about making our elderly clients' last weeks as peaceful and as comfortable as possible in his own bed, in his own home. All of these situations are just a small sample of the common tasks that we do on a day-to-day basis in this line of work. I love my clients, but I believe that for too long, Rhode Island has not valued the contribution and work that direct support professionals provide. While we help enrich the lives of individuals with disabilities, we help them in the communities, we help their families, and many of my co-workers, however, struggle to provide for their own families when they get home. Most DSPs earn between $11 and $12 an hour for the vital services and care we provide. In 1991, I was hired at $10.25 an hour, which at that time was more than double the minimum wage. Over 20 years, I make only a little bit more than $2 an hour more an hour than I did when I started. Most of my fellow workers, including myself, have to work several jobs and large amounts of overtime just to survive. Working 60 hours per week drains us and it impacts our families and our lives away from work. This shamefully low compensation is threatening the quality of care and services we provide. It leads to unsafe levels and staff turnover. At my agency, there are consistently 20 to 25 vacancies posted for DSP positions, many times much more than that. Every year, 33% of our staff quit. This revolving door is bad for our clients who need consistent staffing and to help build relationships. But it's hard to attract and keep people to do this difficult and emotionally intense work when they can make more money at Target or Dunkin' Donuts. Our problem is exacerbated by the fact that Massachusetts, just a few minutes drive from our agency, has a minimum wage of $12 an hour. And Massachusetts is currently paying a group of comparable caregivers in this field a starting salary of $15 an hour and more. I urge the Rhode Island legislature to increase funding that will phase in a minimum wage of $15 over the next 3 years for direct service professionals. Our state is faced with a crisis in care if we do not begin to make meaningful investments in the DSP workforce now. Rhode Island owes it to the legacy of leading the charge for deinstitutionalization and inclusivity, to hear our demand for dignity to individuals living with developmental disabilities and for those who care for them. Thank you.